A Doc SIBO and Max Studio Productions presentation. How SIBO can cause bloating and stomach distension. Bloating and distension of the stomach and gut can occur due to several factors, including swallowing air, blockages in the digestive system, difficulty digesting certain carbohydrates, SIBO, small intestinal bacterial overgrowth, constipation, problems with gut movement, and IBS, irritable bowel syndrome. If the reason for stomach and gut bloating and distension isn't clear, it's essential to examine for any potential underlying organic illnesses, and use precise assessments to determine the root cause. There are various ways to treat this condition, such as changing your lifestyle, modifying your diet, taking enzyme supplements, using substances that lower surface tension, addressing imbalances in gut bacteria, and taking medications to regulate gut movement. Let's focus specifically on SIBO. SIBO can lead to bloating and distension through several mechanisms. 1. Excessive gas production. SIBO is a condition where bacteria grow excessively in the small intestine, causing bloating and distension. There are fewer bacteria in the small intestine than in the large intestine. However, in SIBO, bacteria grow excessively, fermenting carbohydrates and producing the gases hydrogen and methane. These gases accumulate in the small intestine, leading to bloating and distension. Bloating is a feeling of fullness or tightness in the abdomen, accompanied by a visible increase in abdominal size. Distension is the physical expansion or swelling of the stomach due to gas accumulation. These symptoms can vary in severity and are accompanied by other symptoms such as abdominal pain, cramping, and changes in bowel movements. When treating SIBO, the objectives are to rebalance the microbiota in the gut, decrease bacterial overgrowth, and enhance gut health by implementing dietary modifications, antimicrobial therapy, and other interventions. 2. Impaired digestion and nutrient absorption. An excess of bacteria in the small intestine can cause issues digesting and absorbing nutrients properly. This can lead to malabsorption because the bacteria consume some of the nutrients intended for our use. SIBO, small intestinal bacterial overgrowth, is a condition where there is an overgrowth of bacteria in the small intestine, which disrupts the normal digestion and absorption of nutrients. The bacteria have their metabolic processes, and use nutrients such as carbohydrates, proteins, and fats as a source of energy for their growth and survival. As a result, they may consume some of our nutrients before our body can absorb them, reducing the absorption of important nutrients such as vitamins, minerals, and other essential compounds. This malabsorption can lead to deficiencies in these nutrients, affecting our health. Additionally, undigested carbohydrates can fuel the bacteria in the small intestine, causing them to ferment and produce gases like hydrogen and methane. This increased fermentation can produce more gas within the small intestine, leading to bloating and distension. This can be uncomfortable and can contribute to the feeling of bloating. Overall, SIBO can lead to impaired digestion and nutrient absorption, and increased fermentation of undigested carbohydrates, which can cause further gas production and bloating. 3. Disruption of gut motility. SIBO can disrupt the normal movement of muscles in the small intestine, which is responsible for moving food and waste through the digestive tract. This can lead to a buildup of bacteria and gas, which can cause bloating and discomfort. In SIBO, the overgrowth of bacteria in the small intestine can interfere with the proper functioning of these muscles, slowing down food transit, and allowing for prolonged fermentation of undigested carbohydrates. This process generates gas, contributing to increased bloating and distension. Other symptoms can include abdominal discomfort, pain, and altered bowel movements. Treatment for SIBO may involve dietary modifications, antimicrobial therapy, prokinetic medications, and different personalized strategies. 4. Intestinal inflammation and water retention. When bacteria overgrow in the small intestine, it can cause inflammation in the intestinal lining. This inflammation can increase gut permeability, allowing more water to be retained in the small intestine. SIBO-induced inflammation can cause problems with how water is absorbed and moved in the small intestine. This, along with too much bacterial fermentation and gas, can cause water to build up in the small intestine, leading to bloating and a swollen gut. the inflamed intestinal lining cannot effectively regulate water movement, leading to the retention of water and excessive gas produced by bacterial fermentation. SIBO triggers an immune response in the intestine, which aims at controlling and eliminating excessive bacterial growth. However, this inflammatory process can disrupt the normal barrier function of the gut, leading to increased gut permeability, more commonly known as leaky gut. This contributes to gut distension and bloating. The severity of bloating can vary among individuals. It may change throughout the day, or respond to certain dietary triggers after meals. To manage SIBO-related bloating, it is important to address intestinal inflammation and reduce water retention. Treatment options may include nutritional modifications to reduce inflammation, manage symptoms, and support gut healing. Additionally, interventions that target the underlying cause of SIBO, such as antimicrobial therapy, and addressing any underlying conditions or contributing factors, may help alleviate inflammation and restore normal gut function. Please remember that bloating and stomach distension are frequently seen symptoms of SIBO. Still, they may also be linked to other illnesses. Finding a healthcare practitioner, specializing in diagnosing and treating SIBO, is crucial to effectively managing this complicated condition. A SIBO specialist can provide personalized guidance based on your unique situation, including customized treatment plans and ongoing support. Diagnosing SIBO requires specialized tests, such as breath tests, to detect bacterial overgrowth in the small intestine. Healthcare practitioners experienced in SIBO can accurately interpret test results, ensuring appropriate treatment, and avoiding unnecessary interventions. SIBO treatment options include nutritional therapies, antimicrobial therapy, dietary modifications, and lifestyle adjustments. An expert in SIBO can customize the treatment plan to your individual needs, and monitor your progress for successful outcomes. They can also address underlying causes and risk factors contributing to SIBO, manage symptoms, address nutrient deficiencies, optimize gut health, and prevent relapses. It's important to remember that everyone's experience with SIBO can be different. A healthcare practitioner with specialized knowledge and expertise can provide the necessary guidance and support to navigate the complexities of this condition, and help you achieve optimal health through dietary choices, lifestyle modifications, and ongoing support. Thanks for watching.